This is big. We need to talk about how Republicans now want to pay for Trump's big, beautiful bill by making cuts to Medicaid that will cause millions of poor Americans to lose their health insurance and force millions more to face higher healthcare costs. Because Trump has asked Republicans in Congress to pass much of his domestic agenda in one massive sweeping bill. And one of the centerpieces of that bill is $4.5 trillion in tax breaks, with much of that going to finance an extension of tax cuts that Trump put in place during his first term, but that are now set to expire this year. And so to pay for that, House Republicans are working to slash at least $1.5 trillion in other spending areas and directing 11 different committees to come up with cuts. The panel that was asked to make the biggest cuts by far is the Energy and Commerce Committee, which was directed to find at least $880 billion to slash. So as a result, it was widely expected that the committee would be proposing cuts to Medicaid and or Medicare, which make up the vast majority of the spending that the panel oversees. And yesterday, what you saw was the committee rolling out a proposal that would cut an estimated $912 billion over the decade, with most of the cuts, $715 billion, coming from changes to Medicaid and the Affordable Care Act. And among other things, the legislation would add a work requirement to Medicaid for poor, childless adults, requiring that they prove that they're working 80 hours every month to stay enrolled, require Medicaid beneficiaries who earn more than the federal poverty limit, about $15,650 for a single person, to pay higher fees for doctor visits, impose stricter eligibility verification and paperwork requirements by allowing states to check the income and residency of enrollees more often and terminate coverage for those who don't respond in time, freeze a tax that some states impose on providers to obtain more federal funding and pay for large portions of their Medicaid programs, as well as make a number of smaller changes that touch on hot-button social issues like barring coverage for gender-affirming care for trans minors, purging roles of ineligible immigrants, and reducing federal funding for providers that also offer abortion services. Though notably, no federal funds go towards providing abortion specifically, so that move would just cut funding for other essential services provided by places like Planned Parenthood, like contraceptive access, cancer screenings, and more. And Republicans, who have long pushed for many of these measures unsuccessfully, they argue that they are necessary to generate savings and root out waste, fraud, and abuse. But this is, on the other side, you have Democrats saying these efforts are going to hurt millions of the most vulnerable Americans. With, among other things, the party circulating an analysis by the nonpartisan Congressional Budget Office that estimated that this move, it would cost 8.6 million people their health insurance over a decade. And beyond that, Democrats have argued that this proposal will increase premiums for at-risk folks, force hospitals to shut down, and prevent seniors from accessing care. Though also, very notably here, it's not just Democrats who have opposed this effort. We've also seen some Republicans voicing opposition to the move, including Senator Josh Hawley, who wrote a New York Times op-ed literally titled "Don't Cut Medicaid," where he argued, if Congress cuts funding for Medicaid benefits, Missouri workers and their children will lose their health care and hospitals will close. It's that simple. And that pattern will replicate in states across the country. And that is also significant because the proposed cuts are already a pared-down version of what many hard-right Republicans were initially pushing for. Because the ultra-conservative flank of the party, they called for deeper structural changes. But then, many moderate Republicans in vulnerable or swing districts, they pushed against deep Medicaid cuts, and they argued that it could endanger their seats in the House and thus the GOP's razor-thin majority. But even with a more limited approach, it's unclear if Republican leadership will get enough members on board to pass these proposed cuts. With, for example, the Associated Press now reporting that more than a dozen House Republicans have told leadership they will not support cuts to healthcare safety net programs. And all of this playing out as Trump has given some very contradictory and conflicting messages here. He has repeatedly promised that he will not let Congress cut Medicare or Medicaid. I mean, he even went as far as to chastise the media for continuing to ask him about it a few months ago.
The funding bill that passed last night aims to cut $2 trillion. Right. Can you guarantee that Medicare, Medicaid, Social Security will not be touched?
Yeah, I mean, I have said it so many times, you shouldn't be asking me that question, okay? This will not be read my lips. It won't be read my lips anymore. We're not going to touch it. Now, we are going to look for fraud.
But then you also have the Times reporting that he has endorsed the Republican proposal, even as he has remained adamant that he did not want to do anything that could be characterized as a Medicaid cut. With that said, as we wait to get more details, which we hopefully will have soon, it is currently unclear how this is going to move forward as all of this takes shape. So in the meantime, I'd love to know your thoughts in those comments. Hey, thanks for watching, and I hope you enjoyed this clip from the full Philip DeFranco show. And also, a big thanks to Squarespace for sponsoring our Clips channel. Turn your passion into profit over at squarespace.com/Phil, or use the QR code. Because whether you're launching a business or a lucrative side hustle, your website is your digital business card. It's the only space where you control the story, no algorithms or distractions. And with Squarespace, it's so easy because they got a ton of stunning professional templates with drag and drop editing that makes site design incredibly simple, no coding required. So get started for free at squarespace.com/Phil, or scan the QR code on screen and use code Phil for 10% off when ready to launch. Squarespace.com/Phil.